Know the reason why the client is taking the medication. It allows you to anticipate effects of the drugs and observe the client's response, and also to educate the client about the drug. Check the medication administration record. Check for the drug name, dosage, frequency, route of administration, and expiration date for administering the medication. For solid medication, sodium ascorbate 500 mg per capsule POOD. And for liquid medication, Ascom Forte 1 teaspoon POBID. If the MAR is unclear or pertinent information is missing, compare the MAR with the prescriber's most recent order. If the information in the MAR is incomplete, check the doctor's order and compare the MAR with it, since the doctor's order is the official order for the patient. Report any discrepancies to the charge nurse or also to the primary care provider as the agency policies dictates. Verify the client's ability to take medication orally. Determine whether the client is NPO, can swallow, has gastric suction, is nauseated or vomiting, or has diminished bowel sounds. The client can swallow, since in the medication administration record of the client, the medicines will be taken orally. Organize the supplies. Gather the MARs for each client together so that the medication can be prepared for one client at a time. Organization of supplies saves time and reduces the chances of error. Perform hand hygiene. We can use alcohol to deter the spread of microorganisms. Arrange and organize medication cup and tray in preparation area, including medication ticket, if not using EMAR or electronic medication administration record. Medication tickets has different colors, and its colors vary per institution. The white one is for oral meds, standing or PRN order. The blue one is for parenteral medication. And the red one is for stat and now order, and the pink is for nebulization and process. Prepare medication for one patient at a time. Obtain the correct drug. Compare the name of medication on label with EMAR or medication ticket. This drug is for liquid medication, and this one is for solid medication. And for medication ticket, we will use the white ticket, because it is for oral medication. Preparation for solid oral medication. Read the medication and compare it with EMAR or medication ticket. Then after that, place the package unit dose capsule or tablet directly into the medicine cup, but do not remove the medication from its package until at the bedside. If using a stop container, read the medication label and compare it with EMAR or medication ticket. Then after that, pour a required number on the bottle cap and transfer it to the medication cup without touching the tablet or capsule. Keep narcotics and medication that requires a specific assessment, such as respiratory rate, pulse measurement, and blood pressure. Break only the scored tablets if necessary to obtain the correct dosage. Check if the agency requires the pharmacy to split or cut the medication, or nurses can do it. If nurses are allowed, use a cutting device to split the medication. Check the agency policy as to how unused portion of medication are to be discarded. We can use pill cutter crusher to split or cut the medication. There are some institution or agency policy if the unused portion of the medication will be discarded or will be kept for the next use. If the client has difficulty swallowing, check if medication can be crushed, then crush it accordingly. When preparing for powdered medication or effervescent tablet, follow the mixing direction as indicated by the manufacturer. Obtain the drug, then compare the label with EMAR or medication ticket. Prepare the required amount of water, then mix it at the bedside. Preparation for liquid oral medication. Read the medication label and compare it with EMAR or medication ticket. Then after that, thoroughly mix the medication by gently shaking it between the palm. Discard any medication if it turned cloudy or changed color. Expired medication shows sign of precipitation, become discolored, and turn cloudy after shaking it. Expired medication product can be less effective and risky due to a change in chemical composition. Remove the cap and place it upside down on the countertop. Hold the medication bottle with your dominant hand with the label facing up, while your non-dominant hand hold the medication cup. Eye level, while on a flat surface, fill the medication cup with the liquid drug up to the desired level. Wipe the lip of the bottle using a paper towel or a tissue. Then recap. After that, dispose or discard the paper towel or the tissue properly. After discarding the tissue, we can use alcohol to deter the spread of microorganisms. Prepare a liquid medication in a syringe or a dropper if appropriate. Then label the syringe accordingly. Final preparation for all oral medication. Recheck the label on the container before returning the bottle on its storage place. Compare the client's name and label of prepared drugs with medication ticket. Ensure that all medication cap or syringes are labeled properly and accordingly in the medication tray. Lock the medication cart before entering the client's room and check the room number against the EMR. Since we don't have EMR, we use medication ticket. Bring the medication tray with medicine and also include the medication ticket into the client's room. Drug administration and recording. Introduce self and verify the client's identity using the agency protocol. Inform the client about the procedure to be done. Hello ma'am, I am Michelle Beloy from Davao Doctors College, your student nurse for today. And ma'am, may I know your name and when is your birthday? Okay, thank you ma'am. And pero ma'am, magpainong ko sa mga tambal. Kay time naman dito sa mga mag-inom tambal ma'am. Provide for client privacy. It is to protect client's integrity. If you are in a ward area, close the curtain. If you are in a room, close the window and the door. Educate the client and the client family about the medication, its purpose, route of administration, intended effect, and also the possible side effects. So ma'am, ang imong tambal na inomon karon kay sodium ascorbate furnace. Ano siya nga tambal ma'am is for your daily maintenance, and ano siya nga tambal food ma'am kay for prevention and treatment for your vitamin C deficiency. But also ma'am, di kailangan to i-take note ang kaning mga possible side effects, mental or mood changes, nervousness, or also headache ma'am. Perform necessary pre-administration assessment. Assist the client to a sitting position or if not possible, to a side-lying position. Compare name of medication with medication ticket at client's bedside. Administer the medication on a correct time with a proper route. Give a client a sufficient water or a prepared juice to swallow the medication. Stay with the client until all medication have swallowed. Ensure that medication were ingested by the client. Assist the client to a comfortable position. Ma'am, kaya ba di mo bulingkod ma'am? Hindi ba kurang kita ma'am? Para kailan ka kaya ma'am? ensure that medication are given to the right client, right time, and also the right route. Ensure the cleanliness and organization of supplies in the medication tray. Wash all equipment used, dry, and return to its proper place. Dispose all single-use items and perform hand hygiene. Performing hand hygiene deter the spread of microorganisms. Document each medication given, and if the medication was refused, record this fact on the appropriate record. Document the reason and also the nurse's action according to the agency policy. Return to the client when the medication is expected to take effect, usually 30 minutes, to evaluate the effect of medication on the client. Note any adverse effect or any side effect to the client.
So, hi ma'am. After 30 minutes, ibalik ko ma'am para mautana kung saan mo na-feel ka nun ma'am. Sakit sa ulo. Wala ma'am. Pasukaon ka ma'am. Sige ma'am. Thank you ma'am. So, parang manahakal pa ma'am. Sige ma'am. Thank you.
Report significant deviation from normal to primary care provider and document accordingly, including the actions taken.